Good morning, good afternoon, or good evening. As the leading regional health organization in East, Central, and Southern Africa, ECSA Health Community, our mandate for this activity is informed by 3 strategic objectives. The first one is to foster regional health policy agenda, facilitate strategic partnerships and collaboration towards achievement of sustainable development goals, coordinate knowledge generation, management, and utilization to inform decision-making in health programming, to strengthen capacity of member states to implement reproductive, maternal, newborn, child, and adolescent health strategies. The webinar serves all 3 objectives. It was launched in December as part of the Implementation Science Collaborative with support from USAID HERD project and partners. Today's webinar will highlight key learnings from the Advancing Postpartum Hemorrhage Care Partnership portfolio of activities from Malawi and Madagascar. The ECSA Health Community is committed to supporting member states in addressing reduction in maternal mortality. As a platform for priority setting, convening, and knowledge sharing, we are pleased to be co-hosting this webinar and to be housing more information on this topic in our Knowledge Center online. We are excited as this is by far the biggest dissemination webinar with many outstanding implementation science projects from a wide range of our partners. A very warm welcome. We wish you all fruitful deliberations. Thank you.
Good morning, good afternoon, and good evening. Thank you all for joining today's webinar. My name is Laura Reichenbach, and I'm a Senior Associate at the Population Council and the Project Director for Breakthrough Research, USAID's global flagship social and behavior change research project. On behalf of my colleague at URC, who is the Project Director for the Health Evaluation and Applied Research Development, or HERD project, Dr. Jim Sherry, I want to welcome you to today's webinar. I want to start by acknowledging USAID, not only for funding this important work, but also for their vision and intentional request that 2 USAID-funded global projects, Breakthrough Research and HERD, work in close collaboration together on the advancements in postpartum hemorrhage care, or APPHC partnership, to develop a joint work plan to implement multiple activities in 2 countries, leveraging each project's specific areas of expertise: social behavior change, maternal newborn health, and implementation science, to tackle the critical problem of postpartum hemorrhage. This provided an extremely unique and productive opportunity to explore mentorship and its potential for improving provider skills and competency, complemented by social and behavior change and behavioral science approaches to understand drivers of provider behaviors and to identify and test tools and strengthen systems to best support them. You will be hearing about the results of the many activities of this partnership in this webinar. Before turning it over to my colleagues to share the exciting details of the APPHC partnership and its activities, I want to highlight some observations related to the work that you will be hearing about today. The first has to do with the importance of strong collaborative efforts that are reflected in the APPHC partnership. This partnership reflects collaboration across 2 global projects, across missions, bilaterals, ministries of health, and other stakeholders in 2 countries, Malawi and Madagascar, as well as with USAID Washington. It reflects collaboration across disciplines and approaches, the alignment of social and behavior change research and implementation science, as well as collaboration across AOR teams at USAID. The power of this collaboration has brought multifaceted benefits across the APPHC partnership. The partnership has benefited from this in terms of producing a rich and robust set of substantive and technical outputs, many of which you will hear about today. It has enabled the development of a large and complex portfolio of studies, activities, and approaches to examine the issue of PPH from multiple angles, as opposed to a single narrow approach. This collaborative approach has also facilitated the building of the research agenda from the ground up, engaging many stakeholders to create and reinvigorate the agenda, which has enabled full leverage of the investment and successful creation of demand and adapting and responding to needs, which was especially critical and relevant during the COVID-19 pandemic. We hope this partnership model and approach might offer an example of how to foster more responsive and effective collaboration to accelerate the use of evidence and learning to bear on critical health and development issues like PPH. Thank you, and we hope you enjoy the event.
Good morning, good afternoon, and good evening to colleagues and friends around the world. My name is Rebecca Levine, and I am a Senior Maternal Health Advisor in the United States Agency for International Development's Office of Maternal and Child Health and Nutrition in the Bureau for Global Health. On behalf of USAID, I would like to thank each of you for joining today's webinar on the USAID-funded Advancements in Postpartum Hemorrhage Care Effort, or APPHC for short. In 2018, USAID's maternal health team launched the APPHC initiative in an effort to generate and test solutions to address key implementation barriers for PPH prevention and treatment. A critical component of this initiative was to ensure that the barriers and challenges, as well as the solutions, were locally identified, locally developed, and locally implemented. Today, you will learn about some of those challenges, innovative solutions, and the incredible work being done in Malawi and Madagascar to reduce PPH-related mortality and morbidity amidst the COVID-19 pandemic. The learnings from this work will surely influence and inform USAID's maternal health programming efforts for years to come. Thank you for joining and enjoy the webinar.